All right, today we're doing something a little different. We're going to take a tour of your nervous system, and you don't even have to get up. We're talking about the neurological exam. We're going to break it down step by step and see exactly how doctors create this incredible map of your brain and body. You've seen this before, right? In a movie, or maybe you've even done it yourself at the doctor's. Walk a straight line, heel to toe, touch your nose with your eyes closed. It feels a little strange, doesn't it? But here's the thing. Those aren't just random party tricks. Every single one is a very specific question being asked directly to your nervous system. And believe me, the answers it gives back, they can reveal a whole lot. So here's how we're going to break it down. First, we'll cover what your doctor's trying to figure out just by talking to you. Then we'll check in on the command center, the brain itself. After that, we'll look at the brain's direct lines of communication, then test all the wiring throughout your body, and finally, we'll touch on what happens when we need to get a much closer look with some high-tech tools. Okay, so the first thing to know is that this whole tour, it doesn't actually start with a reflex hammer or any of those physical tests. It starts with just a conversation. Your health history, the story you tell your doctor, that's what provides the first, most important clues. It's like giving them a map and pointing out exactly which areas they need to investigate a little more closely. What are they looking for? Well, they're listening for very specific signals, things like pain, any dizziness or weakness. Have you had seizures? Any weird things happening with your vision? See, every single one of those symptoms is like a little red flag on the map, and it helps guide the entire physical exam that's about to happen. All right, now we get to the hands-on stuff. And we're starting right at the top with the command center, the cerebrum. Think of this as the CEO of your entire body. We're about to check in on its executive functions. First things first, before any of the fancy tests, a doctor has to know your level of consciousness. I mean, are you alert? Are you aware of what's going on? And to do this in a way that's not just a guess, they use a really specific standardized tool. And that tool is the Glasgow Coma Scale. What it does is brilliant, really. It takes all these complex observations, like are your eyes opening, are you responding to questions, and boils them down to a single score from 3 to 15. And that number is so powerful. It's like a universal language for doctors and paramedics everywhere, giving them a super fast way to understand the severity of a brain injury. As you can see here, the higher the score, the better. Anything 8 or below, that's a sign of a really severe problem. Okay, so once we know you're conscious and alert, the exam starts to probe a little deeper. Can you speak clearly? Do you understand what I'm asking you to do? How about your memory? Hey, can you remember these 3 words I'm about to tell you? Or what you have for breakfast this morning? Even simple things like asking general knowledge questions or having you count backwards, it all tests your intellectual functions and paints a much clearer picture of your overall brain health. All right, let's talk about that balance test, the Romberg test. So, standing still with your eyes open. Easy, right? But then the doctor says, okay, now close your eyes. Suddenly, you've taken away all your visual cues. Your brain can't see the room anymore. Now it has to rely completely on something called proprioception. You can think of it like your body's built-in GPS. It's that sense of knowing where your arms and legs are without having to look at them. A little bit of swaying is totally normal. But if you start to lose your balance, that tells the doctor there might be an issue with those internal sensory pathways. And what about that finger-to-nose test? You might think it's a test of your aim, but it's not really. It's all about coordination. That simple back-and-forth movement is a direct line to testing your cerebellum. That's the part of your brain that handles all the smooth, precise, planned movements. So if you're having trouble with that simple action, it gives the doctor a very, very specific clue about where to look next. Okay, let's move on. Now we're going to look at what you could call the brain's direct lines. These are the 12 pairs of cranial nerves. The best way to think about them is like high-speed fiber optic cables that run straight from the brain to your head, your face, and your neck. No middlemen. And we start with the absolute basics. Cranial nerve number 1, that's your sense of smell. You know, they might ask you to identify a common scent like coffee. And nerve number 2 is all about vision. That's why you're pretty much always going to find yourself looking at an eye chart during one of these exams. Now, this is cool. It actually takes 3 different nerves all working in harmony just to move your eyes around. That's why the doctor has you follow their finger or a little light. They're not just seeing if you can track it, they're checking that all 6 muscles in each of your eyes are getting the right signals to move up, down, left, right, and everywhere in between. Next, let's look at the face. The 5th cranial nerve, that's what's responsible for sensation and also for the power in your jaw. So when they ask you to clench your teeth, that's what they're testing. Then you have the seventh nerve, and that's all about expression. Smile for me, frown, raise your eyebrows. It's also in charge of taste, by the way. And to wrap up this tour of the brain's direct lines, the last few nerves cover a whole bunch of important jobs. We're talking hearing and balance, your gag reflex, the quality of your voice, even something as simple as shrugging your shoulders or sticking out your tongue and moving it side to side. Those actions are testing these final crucial connections. So we've checked out the command center and we've tested its direct line connections. Now it's time to move down the chain and look at the body's own electrical grid, that huge network of peripheral wiring that handles movement, sensation, and all those automatic reflexes. So how strong are you, really? When a doctor tests your motor function, they'll have you, push against their hand or pull towards them. They're testing your strength against their resistance, and they grade it on this really simple 0 to 5 scale. A 5, you've got normal, full power strength. A 3 means you can lift your arm against gravity, but you can't push back against them. And a 0, well, that's complete paralysis. It's a really fast and effective way to put a number on muscle weakness. Okay, so that was the signals going out. Now let's talk about the signals coming in. The sensory exam is all about checking if that information is making it back to the brain properly. Can you feel this light touch? Can you tell the difference between something sharp and something dull? How about temperature? Or the vibration from a tuning fork on your ankle? What they're doing is creating a map of your sensations to pinpoint exactly where you might be losing feeling. And here it is, the famous reflex hammer. You can think of reflexes as your nervous system's pre-programmed subroutines. They're automatic responses that don't even involve your conscious brain. It's all about speed. That little tap on the knee is just testing the circuit. A grade of 2 is what we're looking for. That's a normal response. But if it's super hyperactive, or if there's no reflex at all, that gives the doctor a big clue that there could be a problem somewhere along that specific nerve pathway. Now, in a more serious situation, if a doctor suspects something like meningitis, which is an inflammation of the protective layers around the brain and spinal cord, they'll look for a couple of key signs. With Kernick's sign, they try to straighten your bent leg and it causes pain. With Brzezinski's sign, when they gently bend your neck forward, your hips and knees bend up on their own. Both of those are classic signs that those protective membranes are irritated. So, what happens when the physical exam doesn't give a clear answer? Or maybe it just raises even more questions? Well, that's when we turn to technology. It gives us something like a satellite view, a way to look directly inside the brain, the spine, and the nerves themselves. And this is where the really advanced toolkit comes in. You've got scans like a CT or an MRI, which let us see the actual structure of the brain. An EEG lets us listen in on the brain's electrical chatter, which is absolutely vital for diagnosing conditions like epilepsy. We can even do nerve conduction studies to test the speed of your body's wiring. Every single one of these tools adds another, more detailed layer to the map. So when you put it all together, you can see that this isn't just a random collection of weird tests. The neurological exam is a deeply systematic process. It's really a structured conversation, one that translates the silent, incredibly complex workings of your nervous system into signs that a doctor can actually see and understand. This amazing, intricate map can help diagnose anything from a simple pinched nerve to a serious degenerative disease. It shows us the machinery, right? The wiring that controls every move we make, every sensation we feel, every thought we have. But it kind of leaves you with a much bigger question, doesn't it? If this is the blueprint for how our entire experience of the world is built, what does that map truly reveal about who we are?